Okay, good afternoon. Are we ready? All right, good afternoon. I'm Josh Jabal, Chief Operating Officer for the state, and I am very excited to kick off this exciting couple of announcements. At the conclusion of a national search, very excited to share that the governor is nominating Dr. Manisha Juthani to be our next Commissioner of the Department of Public Health. Dr. Juthani, just for a quick introduction, is an infectious disease physician. She is on the faculty at the Yale School of Medicine with a joint appointment at the Yale School of Public Health. And she's a practicing physician seeing patients at Yale New Haven Hospital. She has expertise and a long-standing background in infection control, particularly in nursing homes, an area which we've obviously spent a lot of time focused on over the last year and a half. And if she looks familiar, that's because she actually joined one of the governor's daily press briefings last December to share some very moving accounts of some of her patients who had been impacted by COVID, people who didn't think COVID could happen to them, but sharing some of those very personal vignettes of why people needed to be careful with this virus. And subsequently, she's been very active helping us get the word out about how to keep yourself, keep your family safe, and more recently, getting the word out about vaccines, helping support the Department of Public Health, doing media interviews, doing PSAs, and really lending her expertise to our efforts here in Connecticut. So we are absolutely thrilled that Dr. Juthani is taking on this key leadership role in the state of Connecticut. Before she comes up to give some remarks, we want to take a moment to acknowledge and thank Commissioner Deidre Gifford for her service as acting Public Health Commissioner over the last 14 or 15 months now. Commissioner Gifford, as everyone knows, joined the administration to become the Commissioner of the Department of Social Services, one of our largest agencies by any measure, and yet when she was asked over a year ago to take on the additional responsibility to lead the Department of Public Health in the middle of a global pandemic, I can tell you that she did not hesitate to accept that challenge and that additional responsibility. And since that day, with every single minute of every day of the week, she has poured her heart into doing everything she possibly can to keep the people of Connecticut safe and help us chart our way through this most unprecedented time as one of the governor and lieutenant governor's most trusted advisors. And so we are so grateful for her service over this time. And what we are also announcing today is that as she takes off her acting public health commissioner hat, the governor has asked her to put on another hat in its place. So while she will, of course, continue to serve as Commissioner of the Department of Social Services, she is also being tasked with a new role as Senior Advisor to the Governor for Health and Human Services. And in this role, she will play a coordinating function across our health and human service agencies, bringing them together to work on areas where we can better coordinate across the state. In many cases, our health and human service agencies will serve the same people, the same individuals, but from different angles with different systems and different eligibility and different processes in ways that make it harder for them to access benefits and services, in ways that make it more expensive for us to provide those services or to provide preventive services that can actually reduce the overall cost of health care in this state. And so she will take on that role as Senior Advisor to the Governor and help convene those agencies, make recommendations to the governor on policy, working very closely with the Office of Policy and Management and the rest of the administration. Commissioner Juthani will be officially starting September 20th. Commissioner Gifford will remain as acting Commissioner of the Department of Public Health until that time, but she'll start in right away as Senior Advisor to the governor, and we're so grateful for her service. So we're going to hear first from Commissioner, soon-to-be Commissioner Juthani, then Commissioner Gifford, and then the governor.
You're welcome to. I am honored to stand in front of all of you today, and it is humbling to be named the next commissioner of the Department of Public Health. Thank you, Governor Lamont, Lieutenant Governor Weissowitz, Josh Jabal, Dr. Deidre Gifford, for your support, confidence in me, and this opportunity today. It was the first week of March in 2020, and I was asked to see a patient for possible pneumonia. When I saw him, I thought he might be our first COVID patient. There was a dialysis nurse sitting at his bedside, and I turned to her and told her that I was going to test him for COVID. She looked back at me, understood her risks, and went about her job. I had never seen courage look back at me in the eyes like that before that day. That patient turned out not to have COVID, but soon after, I helped care for our first COVID patient in our ICU. And as I saw his chest rise with the assistance of a ventilator, I felt helpless. We tried to get remdesivir, but by the time it arrived, it was too late. After that, there were hundreds of other patients that I helped care for. And when all of us were worried about PPE, I saw nurse after nurse, nurses' aides, respiratory therapists, doctors, and many others enter rooms fearlessly to care for the sick. Healthcare workers throughout our state have been doing their part for over a year and a half, and for that, I thank each and every one of you. But all the while, we have all been dependent on the guidance of people at the Department of Public Health. It is civil servants in the Department of Public Health who have helped guide the way forward. They have been advocating for our most vulnerable, advising nursing homes, helping to construct strategies for physicians in the community, providing guidance on quarantining, on contact tracing, on testing, helping to manage testing at the very beginning of this pandemic, spearheading vaccination efforts, maintaining licensure for all health-related professionals in our state, and so much more. Because of the leadership of Dr. Gifford, the Lamont administration, and because the people in Connecticut did their part to help get this pandemic under control, look where we are today. I want to thank all the members of the Department of Public Health that have been working tirelessly through this pandemic. But COVID is not all of public health. Public health is so much greater than that. And the people that have been working in the Department of Public Health have been doing that during COVID, before COVID, and will continue thereafter. There are so many important issues, like the important initiatives that have been taken regarding drinking water in our state, that are all happening because of leadership at the Department of Public Health. I thank all of you and look forward to getting to know you and work with you. Having said that, there is so much more work to do. This COVID pandemic has shined the light on the importance of public health, mental health, health equity, healthcare disparities, access to healthcare, such important issues that I look forward to working on with the administration, Dr. Gifford in her senior advisor role, other commissioners, and the legislature. I'd like to just tell you a few things about me. I was born in Manhattan. My parents, sitting here in the front row, are Indian physicians, came here in 1970. My husband, Raj, and I started dating actually 29 years ago today. We met in college. My in-laws came to the great state of Connecticut in the 1960s and got their start in Bridgeport, where Raj was born. As the first Indian American commissioner in the state of Connecticut, it gives me great pride to showcase the multicultural state that we are, and to showcase the path that any immigrant can take coming to this state to achieve the American dream. I want to thank all my colleagues at Yale for their support, the Juthani and Mehta families who have supported me all along, my children, Ishani and Shan, who are my pride and joy, and my husband, Raj Mehta, who is my strongest advocate and fiercest supporter. My parents, who helped raise me to be the person I am today. We don't know what public health challenges lie ahead for us, but please know that as a doctor and public health advocate, I will be there to fight for health as a human right and will be ready to take on any public health challenge that faces us. Thank you.
Well, that is a very tough act to follow, but I will do my best, including the advanced preparation of having the step stool under the podium. That's super impressive. Congratulations, Dr. Juthani. It's a wonderful day for Connecticut. I'm so delighted to be passing the reins of the Department of Public Health to someone as well qualified as you are. Dr. Juthani impressed us in so many ways when we were talking to her about this role. First of all, she's highly qualified, having led in the infectious disease program at the Yale School of Medicine, an appointment in the Yale School of Public Health. She has, as you've just heard, a strong commitment to public health, and it's something that she lives and breathes. And when we were speaking to her about transitioning from clinical medicine to public health, she made it very clear that she understands the impact that public health can have on people's daily lives. As you've just seen demonstrated, she's an excellent communicator, and if we've learned anything over the past year, it's the importance of public health communication. So I'm delighted that she's going to bring all of these skills to the Department of Public Health, and look forward to welcoming you to the family of Human Services Commissioners in September. I'd like to take a moment, if I could, to offer some thanks myself for some people who have been assisting me over the past year. First of all, I'd like to thank Governor Lamont for the opportunity to serve the people of Connecticut as the Commissioner of Public Health during such a critical time. It has indeed been an honor, and I am deeply grateful. I'd like to say thank you to Josh, who has many times over earned his honorary doctorate in public health. As you no doubt all know, because of his capacity to answer just about any data question, and I think his mind works in spreadsheets. He's just got a spreadsheet for everything, and a trend line and a rate. But Josh has been by my side since day one of this role, and I could not have fulfilled the responsibility without his partnership. So thank you, Josh. I also would like to say a word of thanks to my husband, Dave Gifford, and my son, Will Gifford. They have been providing counsel, love, and support through some very difficult days. They made sure I had enough coffee, which was very important. Some days I think they stopped just short of cutting up my food and feeding it to me when I was particularly busy. I'm deeply grateful for having them by my side. I'd like to also say thank you to the fabulous team at the Department of Social Services who have been keeping the trains running while I was fulfilling this dual role. They are dedicated public servants, they are experts in their field, and I'm extremely grateful for their dedication. I'd also like to say thank you to my fellow Human Services commissioners and all the commissioners in the executive branch. Governor Lamont, you've heard us say many times, has assembled a team of commissioners who work extremely well together and are very mission-focused. I couldn't be prouder to serve with the commissioners that I serve with, and there were so many days over the past year when they would call or send me a text or check in to make sure that there was nothing they could do to be of support, and I'm deeply grateful. And finally, echoing some of the words of Dr. Juthani, I'd like to say thank you to the team at the Connecticut Department of Public Health. It has been my honor to lead them over the past year. They were hardworking, mostly in anonymity prior to COVID. They've been working extremely hard during COVID, and they will be there after COVID, protecting the health of the people of Connecticut. They get up in the morning, and what they think about is how to keep you safe and healthy, and we all owe them a debt of gratitude. There are some names that you know, like Dr. Matt Carter and Barbara Cass, who have been in the public eye, but there are about 400 other names in the Department of Public Health that you haven't heard and probably won't. Names like Jafar Razek, Vivian Leung, Lori Ann Wagner, Tom St. Louis, Abby Koto, Donna Ortelli, Jamie Kresnitsky, and on and on and on. I wish I could read each of their names, but they have my undying gratitude. Thank you for all that you do. And finally, in this new role, I'm extremely excited to take on, and again, grateful to the governor for the opportunity to further the mission of the Department of Social Services, the Department of Public Health, and work with my fellow commissioners. Whether it's children's behavioral health or early childhood initiatives or nursing homes or improving our technology, we want and need to work together to better serve the people of Connecticut, and I'm deeply honored, Governor, to accept the role as Senior Advisor for Health and Human Services. Thank you.
All right, well, hearing Deirdre talk for a second, it sounded like she was going someplace. You're not going very far. You're going to be right here where we need you. And you got to be so proud of Manisha. Your family's right here with us. We've had a chance to work together a little bit. She sounded like she's sort of ready for the job. You know, she's maybe it's not starting until September 20th, but she's been doing it for us, you know, as a really helpful advisor for me and Deirdre and Josh and Susan for many months. You know, it seems sort of fitting to have somebody who specializes in infectious diseases with maybe a bit of a specialty in nursing homes running public health. Just seemed sort of appropriate, given everything we've got to do and everywhere we've been. And as Deirdre was just saying, Department of Public Health is more important now than ever. We still have a ways to go. We're not out of the woods. We've got this Delta variant. Our infection rate has gone up over 2%. We're still one of the lowest in the country, but don't take any false comfort. We're not an island. We're not out here by ourselves. And our hospitalizations are beginning to pop up a little bit. So this is really a team. This is a time that we need a team with the experience. And Manisha, you bring that to the table. And I am so thankful that you've taken this opportunity. And on behalf of the people of Connecticut, thank you. And I say that to the family here as well. I mean, we're going to take a little bit of her time for a while, but she's going to make an enormous difference in this state. And yeah, Deirdre, as I said, is not going far. You know, one of the things we've found is borders are sort of artificial things. I mean, these are the lazy, hazy, crazy days of summer. And hazy, I think you've been outside a little bit. You see the smog, the fumes coming in from wherever it is, Oregon, Canada, the West. You know, we learned with COVID that there are no borders either. And I think we knew this, but COVID reminded us as we got together as a team across all the different disciplines in state government, how we have to work together. And that's particularly true when it comes to health and human services. And I think Susan and I recognized this early on. For the first time ever in this state, we have decided we need a chief operating officer. Chief operating officer that ties together all the different roles and functions that we try and do, many of which are overlapping, too many of which are operating in their own silos. And, you know, Josh has stepped up in an amazing way to take the lead there. Deirdre was saying how he's, you know, pretty good at learning on his feet, especially when it comes to healthcare. I go around the state of Connecticut a fair amount these days, and everybody always loves to kid me. Wherever I go, they go, "Hey, that's a really tough question. Josh, why don't you take it?" Because we did that a fair amount during our regular press briefings. And, you know, talking to Josh a lot over these last months, we really realized that, in particular, health and human services and public health crosses so many different disciplines. And now that we got Manisha able to fill in and take over and lead public health and give us the energy and sole focus that department needs, we got other things in mind for Deirdre. As Benjamin Franklin once said, if you have something really important to do, ask a busy person. And that's Deirdre Gifford. And so she will, in addition to the Department of Social Services, be our special advisor for health and human services. And that's because when you think about health, it transcends all of our different departments. You know, when it comes to State Department of Education and schools and public health and community-based or school-based programs there, what we have to do in terms of testing, everything we've got to do to get our schools open safely for in-person learning this fall, that requires more than just education. That requires public health. When it comes to making healthcare more accessible, working with the exchange, working to make sure that we can bring down costs, reduce co-pays and deductibles. That requires working with healthcare strategies and other groups that includes, you know, Kevin Lembo over in the controller's office and Deirdre in her special role, be able to help tie together all those different functions in a way that makes sense. We've got groups that deal with the elderly, that deal with nursing homes, deal with veterans, deal with folks with special needs, all of which has healthcare component to it. And Deirdre in her new role is going to help us tie together all those different functions in a way as an advisor, working with all the different commissioners there to make sure healthcare is a key component. And with Josh's efforts in terms of technology, make sure we have the people power to make sure they're talking to each other, and we have the IT, information technology platform, to make sure they're able to coordinate as well. I think nothing else will do when it comes to you know, taking care of the people of Connecticut and dealing with this public health crisis in a coordinated, integrated way going forward. So that's what this day is all about as we keep the lead. And Susan and I are just, you know, really so proud of the three of you and the lead role you're able to take. And look, I'm really proud of the state of Connecticut. We've done really well as a state this last year and a half. You know, thanks to these guys, and she was right there, at least on the sidelines along the way. We got a little bit of work to do, but I think with the team, we're going to get there. We're going to be safe. We're going to be back in school. We're going to be back in work. And we're going to break the back of this Delta variant if you promise to make sure all your friends of friends get vaccinated. Thanks, everybody.
Okay,
Okay, so thank you so much to our media partners for coming, and we'll take any questions.
So, Governor, back in January, you said that you were going to wait, that you had suspended the national search for the Department of Public Health Commissioner. What changed over these past 5-6 months?
I thought we were in the middle of this crisis, and Deirdre was able to handle both really well, and we realized how important it was that DSS and public health be absolutely seamless and integrated. Then we did do, as Josh said, an absolute national search going forward, starting back a few months ago. I had this new role as special advisor. I thought Deirdre was perfectly suited for it, and pretty fast we found the perfect person to lead public health. That was a confluence of things that said now's the time for us to make this change.
Juthani had actually been one of the people back in December who was critical of the speed at which you were reopening the state. So is her appointment to this position any sort of indication that you may be looking to, I don't know, reinstitute travel?
I don't think so. We've had lots of constructive ideas that have come to the table. It's a big table. I want to make sure science is there. I want to make sure that public health is there. We've still got a lot of tough decisions to make. As I said, infections and hospitalizations are up, and nobody better to have at the table than Manisha, Deirdre, and Josh as we make these calls.
Will you be consulting, even though she's not taking the position until September 20th, will you continue to be consulting with her?
She's still on my speed dial.
How many other candidates were interviewed for the job?
Want to take that, Josh?
Sure. We took recommendations of well over 100 candidates nationally. We interviewed dozens and narrowed it down to 5 finalists.
Can we ask Dr. Juthani about Delta variant? Would you like to take a question? Sure.
Booster?
I appreciate that. Can you just describe why people should be concerned? Because on the daily briefing that we get, Delta is less than the Alpha as far as number of cases, and so to the layperson, it would seem like Alpha is more important to be concerned about. Can you just describe why?
So the Alpha variant, which was the first one that we were all knew about, if you look at in the state of Connecticut, how much is Alpha variant? The curve goes like this and then it flattens out, it plateaus. The Delta variant was basically non-existent, and it's on a rise like this. So it's taking off. It's already surpassed one variant, and before we know it, I anticipate it will surpass the Alpha variant. That would be my prediction. It is the most infectious that we've seen out of the variants that are out there. And what we know, though, is that there is one way out of this pandemic fully, which is vaccinations. And we know that vaccinations work against this Delta variant. So if there's ever a reason to go out and get vaccinated, I would say now is the time. And we're seeing around the country that vaccinations are up. People are getting that message, which is great. It's good for us in Connecticut, too, because even though we've done a good job here, people travel and come back.
What's your position on mandating vaccination?
I think we've already seen in healthcare settings that most healthcare organizations are moving towards this. Today, the American Medical Association, American Nurses Association also agreed with the idea that healthcare settings should mandate vaccinations. My feeling, particularly around healthcare settings, is that the most vulnerable come to us in moments of need and sickness, and it is our duty to protect people who are coming to us for care. So I think that is very much in line with what I believe. What we know about mandates in general, they're going to be different stances depending on the organization and what their roles are, but we do know that they work. In general, people usually choose to get vaccinated rather than leave the job.
I was going to say, what about the school mask idea?
Yeah, so I think what we do know is that those who are unvaccinated are vulnerable. I look forward to being in the discussions with the governor and having a seat at the table on this topic. As I said, I'm not going to be in the role until the 20th of September, so there are probably going to be decisions that have to be made before that. But I certainly would reiterate that those who are unmasked are vulnerable to this virus.
How would you handle any disagreements with the governor? If you give him, this is my best advice, and he says, no, I'm going to go the other way. How will you handle that?
So my personal feeling is that any organization needs a leader who has to make tough choices at times. My job is to advise him about public health. As a public health advocate and as a physician, I will continue to do that. But at the end of the day, he's going to have to make tough choices. And I respect that. We've had a very good working relationship over the last year, and I respect his judgment. I admire what he's done. The fact that he got introduced to me because I signed a letter complaining about one of his policies, asked to talk to us, invited me to his press conference to reiterate what I had already told him, that just tells me he's a leader that likes to have different voices at the table. At the end of the day, if he makes a choice different than what I was recommending, I respect that. He has to balance a number of different things when making decisions, but I know that he will listen to me.
Can you talk about your own interest in the job? Obviously, you referenced that you've been a vocal critic at times, so what sort of interested you about taking on this position?
So I was honored when I was approached about the position. I would say that I have been an academic, I've been an investigator, I've been a doctor, I've done a lot of different things in my life, but advocating for the public health of people in the state of Connecticut on a larger scale is not something that I could do in academia in the way that I might be able to have an impact in this particular role. And being asked to serve at the pleasure of the governor is something that is fulfilling a lifelong dream, not really something I would have necessarily known I would have done in my career, but it is fulfilling something I never would have imagined I would have had the opportunity to do.
What do you think needs to happen to vaccinate the segment of the population that either does not want to get vaccinated or has not had the opportunity to do so?
I think we first need to listen and understand why it is that they haven't been vaccinated yet. For some, it seems like even though they've had access, the timing hasn't been right. So I don't always think that it is complete hesitancy. I think we need to meet people where they are. We need to listen to them. We need to understand why they have been hesitant until now. Try to answer what it is that they're hesitant about. For some people, it's just knowing that people they know and trust and love and care about got it and have been okay. And that's enough for them. So the more people that get vaccinated, the more we will reach those people who are still sitting on the sidelines. So I don't think there's any one answer to that question. I really think it depends on who the person is. And I think the number one thing we have to do is to listen first.
Can you talk a bit more as well about your approach to the transition from an academic setting to more of an administrative role?
So I think, first of all, in academia, I've had various different roles. I've had administrative jobs where I have supervised others, so I do have some experience in that. I obviously have seen patients. I have run large grants, so part of that, I actually have a grant that I'm winding down, which I need to do. I actually just got notified this weekend that there may be another grant that I'm getting, so I'm letting them know that I will not be accepting that. So there are a number of different things that I need to set in place to wind down what work I've been doing at Yale for a very long time, and I've been very blessed to be in a community where I've really been able to thrive there. But it's going to take a little bit of time to wind all that down and transition and make sure that all the jobs I currently do can seamlessly be transitioned to somebody else.
One sector of the healthcare industry that so far has not announced that they are requiring vaccines for workers is the nursing home industry. Do you believe that they should move in that direction?
My personal belief as a physician, and not speaking from the perspective of policy at the level of the administration, is that that is our most vulnerable group. And I do feel that staff in nursing homes should be vaccinated. Because in my opinion, if we are going to see a signal of this virus breaking through vaccines, our most vulnerable, which is our nursing home residents, are likely going to be the first ones to experience that.
Do you think incentives work to get people vaccinated? I know that here in Connecticut we've done the concert tickets, but in other states it's been lotteries of $1 million. Is Connecticut doing enough to try and reach people in that regard, and does it even work?
So I can't say that I'm speaking from any knowledge on whether they really work in the states that have done that, but I would say that our vaccination rates are quite high relative to many other states. We're doing some of the best in the country. So I think what we're doing has been working so far. And I think for the people who are still on the sidelines, I'm not sure that big incentives are going to be the thing that pushes them over the edge at this point. I think it's something much more personal, visceral, guttural that they feel. And I think that's where you need to meet people where they are.
Thanks, everybody. Really appreciate it.
Thank you very much.